You're going to take suicidal people into the ocean. Back in the 1990s, I was working in public health and I was disciplined by my managers for having a meeting outside, a walk and talk meeting, because it was seen as skiving or not doing the job properly. Because at the time I always felt constrained in offices and inside buildings, but it was seen as a disciplinary offence to go outside and walk with someone and talk with them. And 15 years ago, when we were starting the surf therapy program, I did a presentation to the health board because the health board had requested whether we could look at surf therapy, and they came back to me with, what, you're going to take suicidal people into the ocean? Are you mad? You know? And now we've got a health board that's desperate for social prescription. You know, that the suits, the grown-ups at the top of the system now suddenly get the idea. And how that has sort of transitioned in my lifetime, you know, is phenomenal. They still can't find the money to fund it, but that's a whole problem for health as it is. So it's really interesting how, and particularly in the last 15 years, and COVID played a huge part in that, accelerated the understanding of how important nature connection is to people. I said, well, if your therapy doesn't work, if you did that outside, at least one, you'd have a walk, and two, nature would touch people. And again, they thought I was bonkers. And I think it switched so many people, decision makers, all kinds of people suddenly realised during COVID how important nature was for them. And it's created a huge social transformation, really, that magazines are full of it.